The evaluation phase of the nursing process is the final part of the nursing process, but in my opinion, it's the second most important aspect. We made it to the last section of the nursing process, evaluating and evaluating outcomes. You'll notice they are both blue because it's the same thing regardless of what term you use. This last step is when we evaluate everything we have done with our patient to see if they met their goals or not. This is the second most important step in the nursing process because it's the step that most often is overlooked, and this is when people die. We do all kinds of things for our patients. We give them meds, do interventions, but we rarely go back and check on them. This lack of evaluation really started when the EMR revolution started. Nurses became doers instead of thinkers when EMR came around. We had cute little task lists on our EMR and we worked hard to make those task lists go away. But there was no task to tell us to go back and evaluate your patients, so nurses forgot about the step. I'm here to tell you this has to change. The picture on this slide shows the nursing process as a linear process from start to finish, but it's actually a circle. We assess our patients, plan their care, do their care, evaluate their goals, and start assessing them again. The circle never ends. Please remember that. It never ends. The basic premise for evaluation is reassessing our patient in regards to the goals we set and saying, did they meet the goals, yes or no? If yes, they met the goals, then that goal is met and we can resolve or end that goal. If they somewhat met the goals, we need to determine why. Is there some element that's not working? Is our goal not realistic? Do we need more time? Did something change with the patient where we may need to change the goal of intervention? If the patient did not meet the goal, we need to figure out why, similarly to what we did in somewhat meets. Sometimes if they don't meet the goal, we have to start all over again with a brand new goal or even a brand new problem. Remember that their nursing process is an ongoing cycle. Okay, ongoing cycle. It never ends. And just FYI, I already mentioned evaluation is the last step, and it's the step that's most often missed. Legally, this is called failure to assess and failure to evaluate, and this is a huge reason why people die and nurses go to court. If we look at evaluation a little bit more in depth, we will actually find that there are 5 elements to evaluation. First, we need to identify what we are actually evaluating. We are not evaluating whether or not the intervention worked. We are evaluating the goals we set. Hopefully the goals we wrote were specific enough that there is little doubt whether or not the goals are met. We need to collect data to determine whether that criteria has been met or not. That means we need to assess or reassess our patient. We need to take into account how the patient feels and whether or not they feel the goal was met. Maybe they had pain and their pain level is now below the goal we set, but the patient still feels uncomfortable. If the patient's still having pain, did we really meet the goal? Next, we need to interpret the findings we just found. Does this sound a little familiar? Then we need to document our findings and our evaluation of the goal. Lastly, we need to determine if we need to terminate or complete the goal or problem, continue it, or modify it. This sounds like a process, doesn't it? I'll be very honest. Sometimes this takes hours or days to make it to this stage, and sometimes it takes minutes and the patient tries to die right in front of us and every goal and plan we had is obsolete. I don't want to discount how important documentation is for this step. When we document our evaluation, we are telling the entire care team what happened with our patient, what goals we set, the interventions we did, and when we evaluate, we're telling them what worked and what didn't. We don't want someone coming after us and trying an intervention that made the patient worse, right? One thing I want to add to finish off the series about the nursing process is that there are different types of care plans. Before EMR, everything we did was on paper, and different schools of thoughts had different ways of doing a care plan. Different healthcare facilities had different ways of doing them, and they even had different names. There were care plans, there were concept maps, there were critical pathways, and more. Basically, what most EMRs do now is an individualized yet pre-programmed plan of care. You have choices in the EMR and you get to select the interventions you want. So if you hear nurses tell you that they don't do care plans in real life, they are 100% lying to you. EMR just makes them very easy to do and almost brainless. But those are for people who have already studied becoming a nurse and already learned what to do. You guys are just starting out. So the care plans you will do will be much more in-depth and time-consuming than any other care plan you will do ever again. This is to help you learn the process and to get you started critically thinking. As you move through the program, the care plans get shorter and shorter because you have that knowledge in your head already and you don't need to think about it as much. And this is it. We finally conclude the nursing process. But don't worry, if you're confused, it's totally fine. We will be working on the nursing process over and over and over again this semester, as this is the basis of everything we do as nurses.